Welcome to KIN 610, Evidence-Based Practice for the Allied Healthcare Profession. This slide is titled Asking because we will be spending some time throughout this online lecture talking about asking or how to ask appropriate clinical questions or answerable clinical questions. So the purpose of this week's module hopefully will be to provide you with the basic definitions of evidence-based medicine and evidence-based practice so that we're all on the same page there, and then hopefully to begin to lay the foundation for teaching you how to form an evidence-based clinical question that hopefully you could use for your either capstone project or your master's thesis project while you're here at Point Loma Nazarene University. I hope that by the time you complete this module, you will be able to develop and create an answerable clinical question, but more importantly, I would hope that you would have a greater understanding of the value of evidence-based practice in the allied healthcare professions. Before we can begin to talk about the steps of evidence-based medicine and how to apply or integrate evidence-based medicine into our clinical practice, we kind of have to start with the baseline definitions. I know, kind of boring, but we have to start somewhere. And so we'll start with the father of evidence-based medicine, or I would call the guru of evidence-based medicine, and that's really Dr. David Sackett. Dr. David Sackett was a clinician, specifically a physician who practiced evidence-based medicine and was one of the first to incorporate and integrate evidence-based medicine into his practice. And so he was also one of the first to create and publish what is called the Oxford Center for Evidence-Based Medicine, which is a website that we will use and consult very often in this class. And it pretty much provides step-by-step instructions on how to integrate evidence-based medicine into any clinical practice. So that could be athletic training, that could be personal training, it could be something like nursing, or even if you're a physician or an aspiring physical therapist as well. So evidence-based medicine, what is the definition, right? Evidence-based medicine, I guess Dr. Sackett would define it as this conscientious, explicit, and judicious use of the current best evidence. And if I could add in my definition of what current best evidence is, I would say that it would represent any research article that you could find within the last 3 to 5 years. What we know as clinicians, right, is that things are constantly changing. Treatments are constantly changing. Rehabs are constantly changing. And so is the type of patient that we are seeing in our clinics as well. So everything's always evolving. So it's always important that if you really want to be current, you're looking at research within the last 3 to 5 years, right? And so we would look at that current best evidence and we would really use it to drive our clinical decisions or drive how we treat our patients in our clinics, right? And then we would say that if we're practicing evidence-based medicine, that would mean that we're integrating our individual clinical expertise, right? Or years of clinical experience, and we're taking that years of clinical experience and we're coupling that with the best external clinical evidence. And we do that by systematically searching the literature and using probably the most rigorous research articles, so randomized control trials, systematic reviews to drive our clinical decision making. Now, we would hope that by making this conscientious, explicit, judicious use of the current best evidence and integrating that into our clinical practice, we would hope that it would truly improve patient outcomes and hopefully also improve patient satisfaction as well. So evidence-based practice is the integration of these 3 components that you see on the screen in front of you. The first component is clinical expertise. The second component is the best research evidence, so you incorporating the best research evidence into your clinical decision making, and then patient values and preferences. So let's define or start with clinical expertise first, since we're all clinicians listening to this video right now. We would say that clinical expertise refers to the clinician's accumulated years of experience. It also refers to your clinical skills, but then it also has another component to it, and that component is the clinician's years of education, right? And so why would education be an important component to evidence-based practice? Well, in order to really truly incorporate evidence-based medicine into your practice, you have to be able to search the literature for the best research evidence, and part of being able to search the literature really has to do with whether or not you've learned how to do that over time. And so the best research evidence is this idea that you would take all of the literature that you found as it relates to a certain treatment or rehabilitation technique or therapy that you'd want to use with a particular patient, that you would appraise that literature and then you would apply it to that specific patient population with the idea that you would improve patient outcomes, right? And so we look at clinical expertise, years of clinical experience, the clinician's clinical skill, the clinician's ability to really truly consult the best literature available and to apply that literature to their patient, right? And so we kind of have to be concerned with patient values and patient preferences, right? What does that mean? What it means is what does the patient bring to the encounter? Well, when we think about it, they have their own values, they have their own concerns. Every patient is very unique. They're also going to bring with them a level of expectation, right? The expectation for treatment might be different when you move from one patient to another. And for sure, every patient is going to have a different set of values, right? When you start applying evidence-based practice or evidence-based medicine into your practice, one of your biggest concerns really should be with patient satisfaction, right? Are they happy with the treatment that you just delivered? Are they feeling improvements? Or are they seeing improvements in therapy, in treatment, in their rehab, as you're starting to incorporate these new techniques that you've just researched? So again, evidence-based practice really has three components, or is the integration of three components, and that is the clinical expertise or the level of experience of the clinician's ability to really truly research and search the literature and find the most rigorous research articles, and then the clinician's ability to truly take into account the patient's values and preferences, and to really ask the patient about their level of satisfaction as it relates to the implementation of evidence-based medicine into their clinical practice. So now what we'll do is we'll kind of talk about the different steps that are involved in incorporating evidence-based medicine into your clinical practice. And we're kind of going to dissect these steps in separate modules. So the first module that we're going to talk about, or that we will explore first, and the first step in the evidence-based medicine process is the ability to ask a clinical question, right? And so I feel like this figure kind of leaves out the patient. Truly, step 1A is the patient walking into your clinic, right? Or a group of patients walking into your clinic with a similar pathology or injury or illness, right? That then leads you to ask a clinical question. Why does this set of patient have this injury or this illness? What happened to this patient to make them rupture their ACL? So you start asking the clinical question, right? And the clinical question is probably the most pivotal part of evidence-based practice. And the reason it's the most pivotal part of evidence-based practice is because it really truly is the foundation for the research articles that you are going to find as you search the literature. So step number one, we really have to be cognizant of is that we're asking important questions about the care of our patients, individuals, communities, or populations. And we'll dive deeper into this in the actual module itself. And so once we've asked, or we've defined, or we've written or created an answerable clinical question, the next thing to do would be to acquire the best evidence, and we would do that through searching the literature, right? And so in module 2, we'll talk about which search terms we're going to use and which search terms would yield the best research articles, and then we'll talk about quality of research articles, right? Randomized control trials versus a case control study, right? Which of these research articles should we be using to change and drive our clinical practice? And then step 3, what we want to do once we've really searched the literature and we have a group of articles is to appraise those articles, right? And that goes hand in hand with acquiring which articles are more rigorous, which ones are we going to throw out, which ones are we going to use for the treatment of this patient that's in front of us. And then after we've decided which articles we're going to use, to me, the most important piece to evidence-based medicine then is applying what we found in the research to the patient sitting in front of us. And then last but not least, once we apply this new treatment or this new rehabilitation technique or this new drug therapy to our patient, we really want to know, was it effective? Did we improve patient outcomes? And if so, then we want to continue to use this treatment. And if not, then we kind of have to reassess. And it might lead us to, guess what? Re-ask the clinical question, reacquire new research articles, reappraise, reapply, and reassess. And so when I think about the process of evidence-based practice, it's cyclical. It's this ever-evolving process where the clinician is constantly learning. But I also like to say that when we look at evidence-based practice and when we really dive deep into evidence-based practice, that it was put into place to improve the quality of care of our patients, but also to improve accountability for us as healthcare practitioners. And what it does is it really creates this environment of lifelong learning, right? Where, okay, this treatment didn't work. We need to reassess. We need to ask another clinical question. We need to go back into the literature. And so really what gets me excited is that we become lifelong learners. So as we end this introduction, what I would leave you with again is this figure right here, where evidence-based practice is the integration of clinical expertise, the best research evidence available, and then patient values and preferences. And then what I would say is that when we integrate these 3 components, what it really truly should do is it's going to drive your clinical decisions. It's going to enhance the treatment of your patients, which would hopefully improve clinical outcomes and, more importantly, improve your patient's quality of life. And then I would say that, one of the things about evidence-based practice is it may not be intuitive, or maybe it is, but it definitely requires a different skill set, right? And so you may find that you're a little uncomfortable in this process, but that it becomes easier as you do it more. It becomes something that's innate. And so we have to remember, we have to be able to search the literature. We have to be able to ask the question. We have to be able to search the literature. Then we have to be able to appraise that literature, apply it to our patient, and then reassess based on patient outcomes. So week 1 module, again, we will be hopefully teaching you how to create or develop a clinical question that hopefully you can use for your capstone project or your master's thesis research as you go through this program at Point Loma. Have a wonderful day.